Good evening, distinguished members of the Appropriations Committee. Thank you for allowing me to testify. My name is Sarah Fox, and I'm the Director of Policy at the Connecticut Coalition to End Homelessness. I speak today representing a broad coalition of more than 100 organizations across the state who are all committed to a common goal of making homelessness rare, brief, and non-recurring. I've submitted written testimony, but plan to focus on just a portion of it. I would like to preface my remarks by first sharing that of the many things our state has to be proud of, our work to address homelessness is at the top of the list. Communities across the country continue to look at our progress even throughout the pandemic and seek answers from us on how to end homelessness. We have proven that homelessness is solvable and requires focus, coordination across state systems, good data to inform and measure our progress, strong state and local partnerships, and investments in innovative and proven strategies. Together, we have made sure that your investments in the Homeless Response Network matter and result in positive outcomes, especially in times of crisis. Today, I stand in awe of the Herculean effort still underway by our frontline providers and staff to keep homeless people safe and swiftly rehoused each and every day. Nonprofit homeless service organizations and the people who work for them have played a critical role in protecting and assisting Connecticut's most vulnerable populations. During the COVID-19 pandemic, emergency homeless services have been an important part of the state's critical infrastructure and emergency response system. But regardless of their essential role, homeless service organizations continue to be funded by state agencies at levels far below the actual cost of delivering services. Adequate funding is paramount to safeguarding the health and economic security of our frontline staff. The net effect of asking providers to maintain, or in some cases do more with flat funding, has been lower wages, lower morale, higher turnover, high vacancy rates amongst frontline staff, and too often our frontline staff are at or near homelessness themselves. The arrival of the COVID-19 pandemic saw these effects most acutely as homeless service organizations found themselves unable to fill staffing vacancies at a time when staffing needs were most urgent. We also know that frontline staff and those fulfilling these essential roles throughout the pandemic are disproportionately people of color. More must be done to protect these workers and their families. We must prioritize funding to homeless service organizations so that every employer is able to provide their staff with a safe working environment and a living wage. This would go a long way towards eliminating the racial and economic inequities that have become so glaring during this pandemic. We must act with shared responsibility to address this public health crisis. We must increase permanent housing options and prevent increases in homelessness. Now is not the time to tighten our budgets and halt our progress. We should not balance our state budgets on the back of the most vulnerable men, women, and children, or those who are playing essential roles on our front line of our state's homeless response system. Thank you to the committee for the opportunity to present this testimony and for your hard work making important and life-saving decisions during this public health crisis.
Thank you. Thank you, Sarah. Thank you so much. Thank you for coming up and testifying all the time too. Thank you.
You got it. Thanks. Have a great day.
You too.